Understanding depression, more than just sadness. Depression is a serious mental health condition. It affects millions of people around the world. It's more than just feeling sad or down. Depression is a complex illness with a variety of symptoms. These symptoms can significantly impact a person's life. Depression can make it hard to work, sleep, eat, and enjoy life. It can affect relationships and overall well-being. It's important to remember that depression is not a sign of weakness. It is a real medical condition that requires understanding and treatment. When sadness lingers, differentiating depression, everyone feels sad or down from time to time. These feelings are a normal part of life. They are usually temporary and pass with time. However, when these feelings are persistent and overwhelming, they may signal depression. Depression goes beyond everyday sadness. It's a persistent state of low mood that affects thoughts, feelings, and behaviors. While sadness is like a passing cloud, depression is more like a storm that lingers. Recognizing the signs, symptoms of depression. Depression manifests in a variety of ways. Recognizing the symptoms is crucial for seeking timely help. Common symptoms include persistent sadness, loss of interest in activities once enjoyed, changes in appetite or weight, sleep disturbances, fatigue, feelings of worthlessness, difficulty concentrating, and recurrent thoughts of death or suicide. If you or someone you know experiences several of these symptoms for 2 weeks or more, it's essential to reach out to a healthcare professional. Inside the depressed brain, physical changes. Depression isn't just in your head, it has a physical basis in the brain. Research has shown that depression is linked to changes in brain structure and function. For instance, areas of the brain responsible for mood regulation, such as the hippocampus and prefrontal cortex, may show reduced activity or changes in volume. Furthermore, imbalances in neurotransmitters, the chemical messengers in the brain, play a significant role. Neurotransmitters like serotonin, dopamine, and norepinephrine are crucial for mood, motivation, and pleasure, and their dysregulation contributes to the development of depression. The causes of depression are complex and multifaceted, involving a combination of genetic predisposition, environmental factors, and life experiences. Family history of depression can increase the likelihood of developing the condition, suggesting a genetic component. Environmental factors such as childhood trauma, abuse, neglect, stressful life events, and chronic stress can also contribute to depression. Moreover, medical conditions, certain medications, and substance abuse can also trigger or worsen depressive symptoms. Despite the prevalence of depression, many individuals delay or avoid seeking help. Stigma surrounding mental health remains a significant barrier, preventing people from talking openly about their struggles and seeking professional support. Fear of judgment, shame, and misconceptions about mental illness contribute to this stigma. Additionally, logistical barriers, such as lack of access to mental health services, financial constraints, and limited awareness of available resources can also hinder help seeking. Fortunately, effective treatments for depression are available. Antidepressant medications, such as selective serotonin reuptake inhibitors and serotonin norepinephrine reuptake inhibitors, can help restore the balance of neurotransmitters in the brain, alleviating depressive symptoms. Psychotherapy, such as cognitive behavioral therapy and interpersonal therapy, provides individuals with coping mechanisms, helps reframe negative thought patterns, and addresses underlying emotional issues. In some cases, a combination of medication and therapy proves most effective. Supporting a loved one with depression requires empathy, patience, and understanding. Encourage them to seek professional help and offer practical assistance, such as researching therapists or accompanying them to appointments. Listen without judgment, validate their feelings, and remind them that they are not alone. Offer to help with daily tasks or engage in activities they once enjoyed, but respect their need for space when necessary. Ongoing research is crucial for improving our understanding of depression and developing new and more effective treatments. Scientists are exploring innovative approaches such as transcranial magnetic stimulation and ketamine therapy, which show promise in treating treatment-resistant depression. Furthermore, research into the genetic and environmental factors contributing to depression is paving the way for personalized medicine and preventive strategies. With continued research and a growing awareness of mental health, there is hope for brighter futures for individuals living with depression.